Hello, my name is Marisa Mercer. I'm an FNP student at the University of Texas El Paso. This is the second video. I'm doing a cardiovascular assessment on my patient Chris here. So I'm going to start off by asking a few questions for Chris and also observing the patient. Just like with the respiratory system, the assessment starts when the patient walks in the room, and I'm looking for any kind of distress, looking at the color of his skin. So Chris, can you tell me, have you had any issues with your heart?
No.
Any increased awareness of your heart rate, palpitations, any fainting or swelling?
No.
So I'm looking at him. I'm also looking at his arms, his legs, looking for any kind of edema, peripheral edema that might indicate possible congestive heart failure or inadequate pumping of the heart. While I've got him sitting here, I'm going to go ahead and check his heart rate as well. I'm going to feel his radial pulse for a full minute. I'm not going to actually do a full minute here, but we'll do about 15 seconds and then I'll multiply times 4. So his heart rate is about 72, pulse is brisk, about 2+. I'm also going to check his blood pressure. Now it's important to have the right size cuff. If you have a patient who is larger, you want to make sure that your cuff is not too small, otherwise you might get an inaccurate high reading. And conversely, with a patient who is smaller, if you use a larger cuff, you would get an inaccurate low reading on his blood pressure. So I'm gonna I'm looking for his heart rate to be around 60 to 100 beats per minute. If it's elevated, then we are looking at tachycardia. If it's lower, bradycardia. Also the feeling for any skips in beats, or also feeling the amplitude of that beat. If it's really if it's more than 2+, then that could be indicative of the heart not pumping adequately. With his blood pressure, normal blood pressure is around 120/80. I might see this elevated in patients with hypertension. I might see it lower in patients that have chronic renal disease. So I'm going to inflate my cuff here, and I'm going to listen over his brachial artery, listening for those heart sounds. I got about 132/78, which is okay, that's normal. So the next thing I'm going to do is I'm going to visually inspect and then also listen to his carotid. So I'm going to have you take your shirt off again for me. Now in the respiratory system, I was looking at the shape of his chest. Now again, I'm looking at the shape of his chest, but I'm also looking for any kind of heaves, any lifts, any kind of precordial movements here. Also looking to see if I can visualize his apical pulse. In patients who are smaller in stature, you might be able to visualize the apical pulse. Now for him, I don't visualize it right now, and then I also don't visualize any kind of heaves or lifts. So I'm also going to measure his jugular venous pressure. For this part, I'm going to have him lay down, and I'll probably just have him stay laying down for the rest of the assessment. Why don't you go ahead and lay down for me? Now I'm trying to estimate his jugular venous pressure to give me an indication of the pumping of the heart. If, for example, my patient had congestive heart failure, I might see an elevated jugular venous pressure. I don't have rulers, but I'm going to use these papers to kind of demonstrate. So I'm going to have him turn his head over to the left there, and I'm going to visualize, or see if I can visualize that pulsation here in his neck. And if I can't visualize it, what I would have him do is bear down to distend that vein, the jugular vein. Can you go ahead and bear down for me? And I can see it pop up right here. So I'm going to put my little pretend ruler here at the sternal angle, and then I'm looking for the highest point of that jugular vein. Right there. So that looks like it's about 2 centimeters above the sternal angle. So I would say that his jugular venous pressure is approximately 2 centimeters above the sternal angle, with the head of the bed about 30 degrees elevated. So that's his jugular venous pressure. Next, I'm going to I'm going to be listening to his carotids, listening and feeling, palpating for that carotid upstroke, amplitude, really looking for any kind of turbulent, or listening for any turbulent blood flow, or seeing any turbulent blood flow as well. So I'm going to have a feel here. Turn this way. Feeling here in the neck area, anterior to the sternocleidomastoid muscle. Palpation, he's about 2+. I'm going to have a listen as well with the diaphragm and the bell to listen for lower or higher pitch sounds. Okay, so his carotid sound perfectly normal. It sounds like the carotid upstroke is about a 2+, brisk, with no bruise or thrills. So next I'm going to be visualizing and inspecting his chest. Moving on from the carotids and the jugular, we're going to be looking for any kind of heaves or lifts in his chest, any pulsations here, especially here in the abdomen, and then right here over the point of maximal impulse. I don't appreciate any of those. So what I would also like to do is listen to his heart sounds. And as I listen, I'm going to listen in 5 different areas. I'm listening over the aortic area, the the pulmonic area, Erb's point where S1 and S2 will be equally heard, tricuspid area here in the 5th intercostal space, and then the mitral area over here in the midclavicular line in the 5th intercostal space. As I listen, I want to be hearing an S1 and an S2. The S1 sound will be heard loudest at the base, at the apex here in the 5th intercostal space, and then S2 will be heard loudest up here at the 2nd intercostal space, at the aortic and the pulmonic area. As I listen, I'm also trying to appreciate any extra heart sounds such as S3 and S4, which would be diastolic in timing. And for example, S3 would be like the Y in Kentucky, with the beginning of the word being S1 and S2, and then that last part being S3. S4 would sound like the 10 in Tennessee. So I'm going to have a listen here, and then I'll try to listen for any murmurs as I'm going, and then we'll see if we need to grade. I'm also going to listen with the bell so I can pick up any lower heart sounds. So I'm not hearing any murmurs, I'm not picking up any extra heart sounds. I'm also going to feel on his chest everywhere that I just listened. In each of these areas, I'm feeling for any impulses, aortic, pulmonic impulses. So next I'm going to try and feel for that point of maximal impulse. Typically the point of maximal impulse is going to be on the 5th intercostal space at the midclavicular line. And sometimes you can visualize this in patients that are smaller. But if you can't, we can feel, and if you still can't feel it in this position right here, then what I can have them do is turn over about 40 degrees. So go ahead and turn for about 40 degrees for me. All right. Again, finding that fifth intercostal space, midclavicular line. And I feel it right here. It should measure approximately less than 2.5 centimeters. And that's exactly where we're at. He's about 2. So if I had picked up a murmur, what I could do to hear better and to try to identify timing, location, and all these things, I could try a couple different maneuvers with him. Now I could try with him in this position. I could try with him laying over in that 40-degree angle. Another thing I could have him do is do a Valsalva maneuver or bear down, so I can pick up those tones. And then another one I could try is have him squatting and then standing and then squatting, to be able to identify those locations and timing. So if I'm looking for a murmur, what I want to know is timing. Is it systolic or is it diastolic? I want to know the shape of it. Does it plateau? Does it crescendo or does it decrescendo? I'm looking at the location. Is it at the base of the heart, or is it at the apex of the heart? Radiation. I'm looking at pitch. Is it a high, low, or medium pitch? Also looking at quality. Is it blowing? Is it harsh? Is it musical? Or is it rumbling? And then you would grade it, and you could grade the systolic 1 through 6, with 6 being the loudest, and then a diastolic murmur is graded 1 through 4, with 4 being the loudest. So that concludes the heart. You can go ahead and have a seat up. That concludes the heart. This patient is very healthy. He has a normal heart rate. He has normal blood pressure. His jugular venous pressure is not elevated. It's exactly where it should be. I don't appreciate any murmurs or any additional heart sounds. I don't notice any heaves or lifts on his chest. Even with his respiratory system, I'm looking for retractions. I did not notice any kind of retractions there either. Up here in the supraclavicular area, also in the intercostal spaces. So we have a nice healthy patient here, and that concludes the cardiac video. Thank you.